Dear viewers, Namaskar. Welcome to the lecture series on food technology. Today, the topic food poisoning shall be discussed under the following subheadings: 1. Introduction, 2. Food poisoning causes, 3. Food poisoning agents, 4. Prevention of food poisoning, 5. Treatment for food poisoning, followed by conclusion. 1. Introduction. Food poisoning, also called foodborne illness, caused by eating contaminated food. Infectious organisms including various bacteria, viruses and parasites and their toxins are the most common causes of food poisoning. Infectious organisms or their toxins can contaminate food at any point during its processing or production. Contamination can also occur at home if food is incorrectly handled or cooked. Food poisoning symptoms often include nausea, vomiting or diarrhea, which can start just hours after eating contaminated food. Most often, food poisoning is mild and resolves without treatment, but some cases are severe, requiring hospitalization. Current food trends reveal that more and more frequently today we prefer to buy pre-prepared ready-to-eat convenience foods, dine out in restaurants and cafes, prefer frozen over fresh products and have a growing demand for foods of animal origin. While this gives us many new choices in the food we eat, a greater risk of food poisoning. Food poisoning is a general term used to describe illness caused by all types of foodborne microorganisms. Food poisoning and food infection are different, although the symptoms are similar. Food infection is caused by eating foods containing certain types of live bacteria. Once the contaminated food is consumed, the bacteria themselves continue to grow, usually in the intestine, and illness can result. Food poisoning is of two types. Food intoxication is caused by eating food that contains a toxin or poison due to bacterial growth in the food. The bacteria that produced and excreted the toxic waste products into the food may be killed, but the toxin they produce remains on the food, causing the illness or digestive upset to occur. Toxin mediated infection is caused by consuming food contaminated by organisms that produce toxins only after they have been ingested into the body. More than 250 known diseases can be transmitted through food. The estimates unknown or undiscovered agents cause around 68% of all foodborne illnesses and related hospitalizations. Many cases of food poisoning are not reported because people suffer mild symptoms and recover quickly. Also, doctors do not test for a cause in every suspected case because it does not change the treatment or the outcome. There are high risk foods which are more vulnerable for food poisoning includes meat, especially undercooked, minced and rolled, farmed or tenderized meats. Raw or undercooked poultry such as chicken, duck and turkey. Raw or lightly cooked eggs, including foods made from raw egg such as unpasteurized mayonnaise. Seafoods, cooked rice not kept at correct temperature, cooked pasta not kept at correct temperature, prepared salads such as colza, pasta salads and rice salads, prepared fruit salads, unpasteurized dairy products and etc. Coming to the second, food poisoning causes. Food poisoning microbes are often present naturally in food, but usually only in small numbers. However, given the right conditions, their numbers can increase extremely quickly so that one single bacterium could multiply to over 16 million in only 6 hours. This is where the food poisoning problem begins. So, it is vitally important that we do not give these bacteria the right living environment where they can grow and multiply quickly. The known causes of food poisoning can be divided into two categories: infectious agents and toxic agents. Infectious agents include viruses, bacteria, and parasites. Toxic agents include poisonous mushrooms, improperly prepared exotic foods, or pesticides on fruits and vegetables. Food usually becomes contaminated from poor sanitation or preparation. Food handlers who do not wash their hands after using the bathroom or have infections themselves often cause contamination. Food poisoning can affect one person or a group of people who all ate the same contaminated food. The germs may get into the food you eat, called contamination, in different ways, are as follows. Meat or poultry can come into contact with bacteria from the intestine of an animal that is being processed. Water that is used during growing or shipping can contain animal or human waste. Food improper handling or preparation in grocery stores, restaurants, or homes. Any food prepared using cooking utensils, cutting boards, and other tools that are not fully cleaned. Dairy products are food containing mayonnaise, such as potato salad, that have been out of the refrigerator too long. Frozen or refrigerated foods that are not stored at the proper temperature or not reheated properly. Contaminated raw fish or oysters. Raw fruits or vegetables that have not been washed well. Packed raw vegetables or fruit juices and dairy products, look for the word pasteurized, which means the food has been treated to prevent contamination. Undercooked meats or eggs. Contaminated water from a well or stream or city or town water that has not been treated. Infants and elderly people are at the greatest risk for food poisoning. You are also at higher risk if having a serious medical condition such as kidney diseases or diabetes, having a weakened immune system, traveling outside areas where you are exposed to germs that cause food poisoning. Pregnant and breastfeeding women have to be especially careful to avoid food poisoning. Coming to 3 food poisoning agents. Viruses. Viruses account for most food poisoning cases where a specific contaminant is found. Noroviruses is also called Norwalk-like viruses. Caliciviruses are a group of viruses that cause a mild illness, often termed stomach flu, with nausea, vomiting, diarrhea, abdominal pain, headache, and low-grade fever. These symptoms usually resolve in 2 to 3 days. It is the most common viral cause of adult food poisoning and is transmitted from water, shellfish, and vegetables contaminated by feces, as well as from person to person. Outbreaks are more common in densely populated areas such as nursing homes, schools, and cruise ships. Hence, the viral infection is also known as the cruise ship illness. Rotavirus. Rotavirus causes moderate to severe illness with vomiting followed by watery diarrhea and fever. It is the most common cause of food poisoning in infants and children and is transmitted from person to person by fecal contamination of food and shared play areas. Hepatitis A causes moderate illness with sudden onset of fever, loss of appetite, abdominal pain, and feeling of tiredness followed by jaundice, which is a yellowing of the eyes and skin. Symptoms usually last less than 2 months, but can be prolonged or relapse for up to 6 months. It is transmitted from person to person by fecal contamination of food. Bacteria. Bacteria can cause food poisoning in two different ways. Some bacteria infect the intestines, causing inflammation and difficulty absorbing nutrients and water, leading to diarrhea. Other bacteria produce chemicals in foods known as toxins that are poisonous to the human digestive system. When eaten, these chemicals can lead to nausea and vomiting, kidney failure, and even death. Salmonella. Salmonella are bacteria that may cause food poisoning. The illness itself is often referred to as salmonella or salmonella infection. The Center for Disease Control estimates that each year 1 million people are infected with salmonella, amounting to $365 million in direct medical cost annually. Salmonella causes a moderate illness with nausea, vomiting, crampy diarrhea, and headache, which may come back in few weeks later as arthritis, that is, joint pains. In people with impaired immune system, such as people with kidney diseases, HIV or AIDS, or those receiving chemotherapy for cancers, salmonella can cause a life-threatening illness. The illness is transmitted by undercooked foods such as eggs, poultry, dairy products, and seafoods. Campylobacter causes mild illness with fever, watery diarrhea, headache, and muscle aches. Campylobacter is the most commonly identified foodborne bacterial infection encountered in the world. It is transmitted by raw poultry, raw milk, and water contaminated by animal feces. Staphylococcus aureus causes moderate to severe illness with rapid onset of nausea, severe vomiting, dizziness, and abdominal cramping. These bacteria produce a toxin in foods such as cream-filled cakes and pies, salads. Most at risk are potato, macaroni, egg, and tuna salads, for example, and dairy products. Contaminated salads at picnics are common if the food is not chilled properly. Bacillus cereus causes mild illness with rapid onset of vomiting with or without diarrhea and abdominal cramping. It is associated with rice, mainly fried rice, and other starchy foods such as pasta and potatoes. It has been speculated that this bacteria may also be used as a potential terrorist weapon. Escherichia coli, commonly called as E. coli, causes moderate to severe illness that begins as large amounts of watery diarrhea, which then turns into bloody diarrhea. There are many different types of this bacteria. The worst strain can cause kidney failure and death, about 3 to 5% of all cases. It is transmitted by eating raw or undercooked hamburger, unpasteurized milk or juices, or contaminated well water. Outbreaks of food poisoning due to E. coli have also occurred following ingestion of contaminated produce. Shigella, which is commonly called as traveler's diarrhea, causes moderate to severe illness with fever, diarrhea containing blood or mucus or both, and the constant urge to have bowel movements. It is transmitted in water polluted with human waste. Listeria monocytogenes. Listeriosis is a moderate to severe illness with nausea and vomiting. Some affected individuals can progress to develop meningitis from listeria. It is transmitted on many types of uncooked foods such as meats, fruits, vegetables, soft cheeses, unpasteurized milk, and cold cut meats. Pregnant women and newborns are at increased risk for serious infections. In the United States of America in 2011, in an outbreak caused by tainted cantaloupe, 25 people died and 123 people were infected. Clostridium botulinum, it is also called commonly botulism, causes severe illness affecting the nervous system. Symptoms start as blurred vision. The person then develops problems in talking and overall weakness. Symptoms then progress to breathing difficulty and inability to move arms or legs. Infants and young children are particularly at risk. It is transmitted in foods such as home packed canned goods, honey, sausages and seafood. Because botulism can be released in the air, it is considered a potential biological weapon for terrorists. Vibrio cholerae causes mild to moderate illness with crampy diarrhea, headache, nausea, vomiting and fever with chills. It strikes mostly in the warmer months of the year and is transmitted by infected, undercooked or raw seafood. Vibrio parahemolyticus causes moderate to severe abdominal cramping, nausea, vomiting and fever. In immunocompromised individuals, it can cause severe or deadly disease. It is transmitted by eating raw or undercooked fish, particularly oysters. Parasites rarely cause food poisoning. When they do, they are usually swallowed in contaminated or untreated water and cause long-lasting but mild symptoms. Giardia, it is also called beaver fever, causes mild illness with watery diarrhea, often lasting 1 to 2 weeks. It is transmitted by drinking contaminated water, often from lakes or streams in cooler mountains climates. The infection can also be spread from person to person by food or other items contaminated with feces from an infected person. Cryptosporidium causes moderate illness with large amounts of watery diarrhea lasting 2 or 4 days. May become a long-lasting problem in people with poor immune system. It is transmitted by contaminated drinking water. Toxoplasma. The Center for Disease Control estimates that more than 60 million people in the United States carry the Toxoplasma parasite. But few have symptoms because the immune system keeps the parasite from causing illness. When it does cause disease, symptoms include headache, blurred vision and eye pain. It is transmitted by eating undercooked or raw meat, contaminated water or contact with contaminated cat feces. Pregnant women and those with compromised immune system infected with Toxoplasma can have severe health complications. Toxic agents are the least common cause of food poisoning. Illness is often an isolated episode caused by poor food preparation or selection, such as picking wild mushrooms. Mushroom toxins. Illness can range from mild to deadly depending on the type of mushroom eaten. Often there is nausea, vomiting and diarrhea. Some types of mushrooms produce a nerve toxin which causes sweating, shaking, hallucinations and coma. Mycotoxins. Mycotoxins causing food poisoning brought the attention of the scientists in early 1960s. Aspergillus was first described almost 300 years ago and is an important genus in foods. Most Aspergillus species occur in foods as spoilage or in biodeterioration. They are extremely common in stored commodities such as grains, nuts and spices. Almost 50 species of Aspergillus have been identified as capable of producing toxic metabolites. Chief toxins produced by Aspergillus species are the aflatoxins produced by Aspergillus flavus, Aspergillus parasiticus, Aspergillus nomeus, ochratoxin A produced by Aspergillus acraceus, sterigmatocystin produced by Aspergillus versicolor, cyclopenozoic acid produced by Aspergillus flavus and Aspergillus temari, citrulline, penicillin and penicillic acids, Other mycotoxins involved are the toxins produced by the fungus Fusarium, Eurotium, Penicillium, etc. Cigatura poisoning caused by eating fish that contains toxins produced by a marine algae called Gamberdiscus toxicus. It can cause moderate to severe illness with numbness of the area around the mouth and lips that can spread to the arms and legs, nausea, vomiting, muscle pain and weakness, headache, dizziness and rapid heartbeat. The toxin may cause sensory problems in which hot things feel cold and cold things feel hot. It is transmitted by eating certain large game fish from tropical waters, most specifically barracuda groupers, snapper and jacks. According to the CDC, cigatura has no cure. Symptoms may disappear in days or weeks, but may persist for years. Pesticides cause mild to severe illness with weakness, blurred vision, headache, cramps, diarrhea, increased production of saliva and shaking of the arms and legs. Toxins are transmitted by eating unwashed fruits or vegetables contaminated with pesticides. Coming to prevention of food poisoning. Food poisoning can be avoided by preventing food from being contaminated with pathogenic bacteria, preventing any bacteria present in the food from multiplying, destroying those bacteria that are present in the food, inspecting all food and washing fruits and vegetables with water of drinking quality before preparation, separating raw and high risk, cooked and ready to eat foods at all stages of preparation, storage, display and distribution. Not using the same equipment, utensils and working surfaces to handle and prepare raw and high risk cooked and ready to eat foods. Keeping foods covered as much as possible, preventing insects, animals and birds from entering food rooms, not using unsuitable, defective or dirty equipment, using good personal hygiene practices, always including hand washing, not coughing or sneezing over or around food and wearing suitable protective clothing, using the correct cleaning procedures, especially the washing and sanitizing of all equipment used to prepare raw food, including benches and chopping boards. Promptly removing unfit or waste food and refuse from food areas. Keeping high risk foods at temperature that inhibit the growth of bacteria, that is out of the temperature danger zone. Food should be kept below 4 degrees Celsius in a refrigerated unit or above 70 degrees Celsius in a suitable warming unit, ensuring that during preparation food is not in danger zone for even a short time. High risk food must not be left sitting out at room temperature. Using appropriate packing methods like gas flushing or vacuum packing for food products, preventing dried products from absorbing moisture, serving food as soon as possible after preparation, adequately cooking food, ensuring that a minimum internal cooking temperature of 80 degrees Celsius is reached, using suitable processing methods such as pasteurization, canning or sterilization. Coming to the last aspect, treatment for food poisoning. Food poisoning persons usually recover from the most common types of food poisoning within a couple of days. The goal is to make feel better and make sure patient's body maintains the proper amount of fluids. Should not eat solid foods until the diarrhea has passed and avoid dairy products which can worsen diarrhea, maybe due to a temporary state of lactose intolerance. Drink any fluid except milk or caffeinated beverages to replace fluids lost by diarrhea and vomiting. Give children an electrolyte solution sold in drugstores. If patients have diarrhea and are unable to drink fluids, for example, due to nausea or vomiting, need medical attention and fluids may be given through a vein by doctors. This is especially true for young children. If patients take diuretics, need to manage diarrhea carefully. It should be done with consulting healthcare provider, otherwise patient may need to stop taking the diuretic while having the diarrhea. Never stop or change medications without talking to your healthcare provider and getting specific instructions. For the most common causes of food poisoning, doctor would not prescribe antibiotics. Do not use these medicines without talking to healthcare provider if patients have bloody diarrhea or a fever. Do not give these medicines to children. If patients have eaten toxins from mushrooms or shellfish, need medical attention right away, the emergency room doctor may take steps to empty stomach and remove the toxin. Possible complications: dehydration is the most common complication. This can occur from any of the causes of food poisoning. Less common but much more serious complication depending on the bacteria that are causing the food poisoning. These may include arthritis, bleeding problems, kidney problems, damage to the nervous system, and swelling or irritation in the tissue around the heart. In conclusion, food poisoning is a common problem that affects millions of people in the world, including India, in each year. Most cases of food poisoning resolve on their own. Prevention is key and depends upon keeping food preparation areas clean, good hand washing, and cooking foods thoroughly. Food poisoning is the name for the range of illness caused by eating or drinking contaminated food or drink. It is also sometimes called foodborne illness. When dealing with food, we must remember and practice the old age saying, "When in doubt, throw it out." Thank you.